Okay, we can wait for more participants, I think, a few minutes later. Dilara, shall we start? Or I think the participants number is so low, but it's 7:30. You're muted, Dilara.
I'm also announcing it on Instagram. Let's start with introducing ISPA and ECZARTI, and I think they will catch up with the Miss Ingi's.
Okay, so I should start now, right?
Yes.
Okay, did you start recording this and putting it on YouTube, the live broadcast? Okay. So hello guys again, and welcome to this event, the last day of event of ECZARTI on October 30. Unfortunately, it's the last day for the October's event. And also, again, it's me. For the ones who don't know me up till now, I'm Joanna El Masri, a second-year pharmacy student at Estin University and studying it in English. I'll be the moderator today for this event. And also, I'm a member at ISUPA club, and I'm responsible for the international relationships. Please, I would like to ask you to keep your microphones closed until the session ends. At the end of the session, you can open your microphones and ask your questions to our professional, or you can type it on the chat box and I can read them for our professional. Before starting actually our event today, I would like to give a small recap about the ECZARTI event and about the ISUPA club. I know most of you knew what ISUPA and ECZARTI are about, but I think there are more new students today, so it's better to talk about them again. About ISUPA, ISUPA is actually named as Estin University Pharmaceutical Association, and it was formed by Estin University Faculty of Pharmacy students in 2017-2018 academic year. ISUPA makes so many contributions to the society. So from them, ISUPA contributes to the development of pharmacy profession in Turkey and through the whole world. Also to make useful and innovative contributions to health world and social life. Supports students to prepare for future world. It aims to work for the development of professional social skills. And also, again, the ISUPA club has many commissions. It has actually 10 commissions, which are activated according to the students interested, and they are social media commission, press release, international communication commission, which I'm actually a part of now, and the project education, scientific activity, social responsibility, informational technology, fundraising, and graphic design commissions. So I really advise the pharmacy students to enter one of these commissions because they are really so beneficial. And now about the ECZARTI event. Actually how the idea started. As pharmacy students, we are aware of the importance of having knowledge in different fields in addition to the professional training we receive. We have prepared a concept that we will realize every month in order to increase the awareness of our friends from every department and university. We aim to bring together competent speakers and students on career, volunteering, technology, and international opportunities path that we set out. This is basically the idea of ECZARTI, the full range of activities we have organized for students to determine for students to determine the right career path by getting to know themselves, to master concepts that we already talked about, like volunteering, career, abroad opportunities, and today we are going to talk about the literacy concept. These are the concepts that we actually master in this event. Also now we can officially start our last event, unfortunately, for tonight with our Professor Inji Kayen, the head of the Analytical Chemistry Department at our university, Estin University. And personally, I'm so glad for having her today, since I took the last semester with her the Medical Communication Skills course. And this semester, I'm so glad for taking with her the Analytical Chemistry and the Health Literacy course. Professor Inji Kayen, welcome again. And we are really all interested, I hope. We are interested for knowing more about health literacy, and I think the topic will be so beneficial, especially we are having so much students from different departments and from different universities. So welcome again, Professor.
Thank you very much.
You're welcome. I'll start sharing the video that you requested to share. Okay, just a second. Okay, guys, you can see it, right? I'll start it now.
Okay.
Professor, you can share your screen now.
Okay. Are you sharing the screen for the presentation, or how do we proceed?
I can share it too if you want.
Okay, please. Okay. Hi to everybody. Good evening. I'm very glad that I am together with you tonight. Actually, it's nice to see you all. I thank you especially for ECZARTI, the organizing committee, and also Joanna for supporting me with this presentation. Actually, the topic we are going to talk about is health literacy, which is a very, very essential, very, very important, and a very, very significant subject to be discussed, as it is directly related to our health issues. Okay, next slide, please. Okay, in the film, actually, I hope you liked it, because when I watched it, I really liked it. I have seen once more that literacy is a very wide concept. I mean, when you just think about literacy, the word definition of it would be, glad to see you, yes. Okay, the literacy, just by the word, it means reading and writing. I mean, this is the first thing we remember, it comes to our mind, what literacy is about. Actually, literacy is not only about reading and writing, but it has a very, very broader meaning, as we have also seen in the video. What is it? Let's see now. Next slide, please. Literacy actually combines all activities such as reading, writing, speaking, listening, and thinking, as well as comprehension of the importance of the written and verbal language, which is vital for the effective communication. It is very, very interesting, actually. I mean, when we talk about literacy, the first the definition of the first definition of the literacy was in year 1951, very much in the past, and it was done by UNESCO. And it said that it is just a person who can read and write in simple terms is a literate person. But then, starting from 1960s, the concept, the definition has changed. And it has added some more things, actually. And it says that a person, a literate person, should contribute both to himself and also to the society if he is a literate person. This is, I think, a very important development in the terminology literacy. And it is something which we need to consider about it. Okay, what are literacy levels? There are different literacy levels. It can be basic literacy, functional literacy, or multifunctional literacy. If it is basic literacy, we just give meaning to the words. I mean, we just express ourselves. But if it is functional literacy, then we start communicating. I mean, the communication skills, the social skills come into the picture. And what about multifunctional literacy? If we are multifunctional, then we read, we write, but we also share what we read and write with people around us. I mean, we try to utilize what we have as knowledge just to improve, for the improvement of ourselves and also for the society. Okay, what are types of literacy? I mean, literacy is the word which you are going to get acquainted more and more today and in the coming years. We have different types of literacy. We have visual literacy, for example. If you can understand, if you can just interpret the graphics, the texts, I mean, the pictures, then it is visual literacy. There is computer literacy, which is very, very vital and is very essential in our age. Also for the future, of course. I mean, with computer literacy, what we mean is that, I mean, you use the computers effectively in order to communicate, in order to get information. Information literacy is actually connected to computer literacy, and it is very, very important, especially in literacy, to reach the proper information sources. Media literacy, this is the most important one, actually, because media is very, very influential on us. I mean, you all know about it. Media can even change our behaviors, our culture, our attitudes and everything. And in that respect, we should be very, very careful about the messages we get from the media. Technology literacy is the last one, and it's also very, very important. I mean, to be aware of the new developments in the technology is something which we all need to follow, and it is very, actually, I mean, after we are now over the industrial age, it's the technology age, and even it is more the data age, the information age. We have to follow the technology very closely in order to understand what's going on around our world. Okay, the word health literacy, the word which I like best. Health literacy is very, very important. Why? Because, I mean, we are going to talk about it for the next few 30 minutes, actually 40 minutes. It is for the promotion, for the maintenance, for the improvement of health. Health literacy is very important through our life courses. Actually, we make informed decisions and we take actions about promotion and protection of health by the use of health literacy. This is the definition of the health literacy concept. Actually, it's a very long one. I mean, the academicians, the professors or the scientists who talk about health literacy always say that it's very complicated. I mean, when you look at the concept, it is actually not very complicated. I do not agree with this, but you have to put it into parts in order to understand the health literacy concept. It is actually the knowledge that the individuals have accumulated regarding basic health information and services, which will drive their decisions and behavior about themselves and public health. What are the keywords here, actually? Health literacy is the knowledge. It is for ourselves, and it's also for the public health, and it is the accumulated information, accumulated health information, and we make use of this accumulated basic health information for ourselves, for services, and for our healthcare issues. Furthermore, it involves how the information is accessed, understood, evaluated, used, and transmitted from generation to generation. We have to understand, access, acquire information. We have to understand the information. We have to evaluate the information. We have to use the information, and we have to communicate the information. We should not keep it to ourselves. This is the health literacy concept model, which has been developed by Sorensen and his colleagues. Actually, just in the middle, we have the knowledge, the competence, and the motivation, which we need for the health literacy. These three words: we need to have the knowledge, we need to have the competence, we need the ability, and we need the motivation. For what? For accessing, understanding, appraising, and applying this health information. For what? For health protection, and also for disease prevention, as well as other healthcare issues. Okay, this is very good. This is the health literacy concept. And what is the outcome of the health literacy concept, actually? The outcome of the health literacy concept is that, that we use better health services. And if we use the better health services, then the healthcare costs will, of course, decline. Other than that, I mean, our health behaviors are changed. If our health behaviors are changed, then this means that the health outcomes will be better, and our diseases will improve, our health will be improving, and in that respect, we will not be visiting the hospitals more after another. Other than that, it is also the participation which is involved. I mean, the outcome, one of the outcomes. It is very, very important. This is something which is essential. You know that you have to be in the middle of the decision, healthcare decisions, together with your healthcare professionals, in order to be, to have a good outcome of your health issues. In that respect, I mean, participation is also very, very important. It makes the patient empowered. And equity is also another issue. Okay, health literacy is a continuous progress, and progresses gradually in individuals. It is like literacy, which I mentioned previously. We have the functional health literacy, interactive health literacy, and critical health literacy. If we have functional health literacy, if we are at that level, then we can just, read the package of the medicine, or I mean, we can understand the brochure given to us, handed to us by the pharmacist or the doctor. If it is interactive health literacy, then if we are interactive, then this means we have more social and communication skills, and we start talking to our physician, discussing our issues with the physician, and trying to understand, I mean, what is told to us. When it comes to critical health literacy, it is more advanced, actually, and this is now more social and also more cognitive skills, which are added on the top of the what you have already. And critical thinking starts working here, and you start to criticize also, I mean, what you talk about the health issues. Okay. Actually, health literacy levels are low for the whole world. I mean, some of the studies show that, for example, in the United States, the Hispanics, the Spanish-talking patients over 65 of age, not patients, but the population over 65 of age, has almost over 60% are illiterate. I mean, they don't have enough or a good level of health literacy. For the white Americans, actually, I mean, it is around 33% that over 65 of years old white Americans are illiterate. When we look at the European countries, it varies from country to country. But for example, it's again in Bulgaria that around 60% of the population is illiterate. And in case of Turkey, actually, we have almost also 2/3 of the population illiterate. Okay. But this is, again, when I'm saying illiterate, please do not misunderstand it. It means that they do not have adequate or sufficient literacy level. Okay. Health literate is, for individuals, is something, I mean, when we talk about health literate, we always blame the patients and, the people, the individuals, and say, this is an individual who is illiterate, but this is not, of course, the case. We are going to discuss it. Next slide, please. Talking from the individual's point of view, actually a health literate individual knows knows to choose the healthy lifestyle. I mean, he can or she can communicate better with healthcare providers. She can access or he can access health information and services, manage chronic diseases, and engage with health education promotion. What are the basic problems concerning actually health literacy? One of the major basic problem concerning especially the individual health literacy is the personal one. Due to embarrassment, fear, insecurity, or lack of self-esteem, sometimes the individual doesn't talk to the healthcare professional, and it hides the level of the knowledge. Limited communication with the healthcare provider due to the concern she will not be able to express himself or herself correctly. And what it will be the outcome is naturally that the healthcare professional who wants to confirm the information given by the finding, I mean, cannot help the patient. Okay. Actually, also there are some hesitations in communication which arise from a relationship strength or other reasons. For example, I mean, sometimes the patient is uncomfortable because he or she sees the physician or the pharmacist as a powerful person, as an authority symbol, and in that respect escapes asking questions. Also, they may sometimes have fear from professionals' anger or impatience, and sometimes they can have bad relationships with the healthcare professionals. These are all the basic problems concerning the individual's health literacy. Okay. Other than that, there is, of course, another aspect. Other than the individual, the patient's or the healthy person's concerns, hesitations, or problems, the medical information is not explained in daily terms or in a way that the patient understands from the point of view of the pharmacist or the healthcare professional or the doctor. And there are also anxiousness over a recent diagnosis, especially with the individual. I mean, for example, just think about it. You are diagnosed with diabetes, and it's a big shock, and you are anxious. And in that respect, I mean, you just block communicating. Other than that, there are also some cultural barriers which block the health literacy issue. Then what happens as a result? Patients are misdiagnosed, they cannot be supported, and disease and injuries that occur if treatment is not received or delayed will cause, of course, increase of costs. What are the outcomes of low health literacy levels? There is a decline in healthy quality of life. There is, I mean, then the patient is or the person is unhealthy. Lack of knowledge and insufficiency in chronic disease management. I mean, with diabetes, with hypertension, with asthma. I mean, the lack of knowledge would be, you know, causing the recurrence of the illness, the worsening of the illness, especially with the chronic disease. Difficulties in preventing preventable diseases. Less participation in screening programs, for example, I mean, for the early diagnosis of cancer, you have to go to some screening programs. But I mean, if you don't do it, then of course you have the disease. Difficulty in treatment compliance. I mean, if you do not use your drug properly as it should be, then it's again a big issue because then you will not be getting better. The problem of understanding and applying preventive health services, vaccination, for example, if you are not vaccinated, then it's a big issue. Difficulties in accessing healthcare. I mean, if you cannot access to the healthcare, if you do not go to your appointments, then it's a big issue. And of course, at the end, there's an early stage and increasing mortality problem. Okay, health literacy is an effective evidence-based strategy. And there are information sources for health literacy. There are the health professionals, there is the medical literature, books and bulletins in medical and health areas, there is the internet, and TV and other mass communication channels. These are all information sources for health literacy. It is very, very important that, I mean, when you look for information for health issues, I mean, even with the health professionals, you should try to understand who this person is and try to understand that he is not advertising for, let's say, for a pharmaceutical product. You have to challenge that. I mean, you have to think about it, and you have to not to accept what he's saying. If he's from a good university, I mean, if he has a good reputation, then it's good that I mean, you just listen to him. Medical literature is also another issue. I mean, there are some medical literature which are ranked better than the others. The better medical literature sources are better, of course, resources. Books and bulletins and medical and health areas are also another issue. Internet is very, very critical, actually. TV is very, very critical. Again, you have to challenge the information. When you go into internet, especially, I mean, the information you get, for example, from World Health Organization, or with extensions org, org, or with extension edu, or would be more powerful, more reliable, or more evidence-based than you get information from other sources. Therefore, your role would be always to challenge the health information you get from different sources. Okay. Actually, I'm talking always. I don't know if you are listening or not, but if you have, I think, Joanna, we are going to ask the questions at the end, most probably.
Yes, but if someone wants to contribute, you can open your microphones, guys.
I mean, I'm ready to listen to you if you have different thinking. I mean, if you want to challenge me sometimes also during my presentation.
I think they will leave their questions till the end. I hope so.
Okay, good. Thank you. I mean, when you communicate as a health literate person with the professional healthcare profession, then you have to ask a few questions. I mean, this is very, very important as a literate person, health literate person. You have to ask him, what is my main problem? What do I need to do? And why is it important to do this? This is very, very important. 3 major questions to be asked when you are facing a healthcare professional. I mean, you have to ask some questions always because you have to have participation in the decision about your health. This is very, very important. Okay. What about the role of health professionals? Now we continue with that. The health professionals should look for clues, for example, like missed appointments, not taking medications, incomplete forms, not taking notes. And sometimes with verbal communication, you can find some clues about the patient also. For example, as a pharmacist, I mean, you can just ask the patient to read the information on the packaging, and if he or she says that she has or he has forgotten his glasses, this is very typical, of course, then this means that, I mean, he or cannot read, for example, or I mean, she has problems with her eyes. This is a clue. Using audiovisuals, using demonstrations, especially, for example, for an asthma patient, you have to use the device which they use for their treatment. You are to highlighting circle points, using plain language, using teach-back technique. I'm telling to the patient that when you go home, please just tell, what are you going to tell your let's say husband about what I have told you. Encouraging active participation to health decisions is all that should be done by the healthcare professionals. This is what we expect from them. Actually, health literacy is a globally well-recognized asset for all, for everybody, for the whole world. And it is very, very important because, I mean, at all age groups, health literacy is valid for newborns, for children, for adolescents, for adults, for elderly. It's not only for patients, but also for healthy individuals, for refugees. I mean, for academicians and health educators, health literacy has a very important role because they have to support the health literacy. Other than that, of course, midwives, physicians, nurses, all the healthcare professionals are playing an important role. They are the shareholders of the health literacy concept. The NGOs, the public health service providers and health service suppliers are also important players in the health literacy concept. Okay. Health literacy is important because it has social, economical, and healthcare outcomes. The social outcome is, of course, I mean, the quality of life of people will be declining if they are health illiterate. Economically, it will be a burden to the economy. Why? Because if you are illiterate, if you have a low level of literacy, then you will not be going to doctor visits, or you are not going to communicate with your pharmacy and not use the medication properly, which will then have an impact on the economy, as you are not going to get, as your disease will be repeating and, you know, just not doing well. Okay, who is responsible for health literacy? I mean, is it individuals? Is it public? Is it health professionals? Is it health service providers? Or is it the media? Actually, I mean, all are responsible for health literacy. And in that respect, multidisciplinary approach in health literacy is vital and very important, and it needs to be done for the good sake of the society. Okay, how can we improve health literacy? I mean, through health communication and also through health education, we can improve the health literacy. As I've told you, it is not, it is all of us, I mean, as individuals and as the society, we have this responsibility, okay? Health communication actually and health education programs should be developed for the individuals, for the society. And it is quite interesting that the goal is not only to focus on poor health literacy individuals, but also who are good literate, because the good literate will be good role models for the low illiterate ones. And awareness also should be built among the health professionals. Actually, I mean, this is something which we are doing at our university. Lectures and seminars should be organized in the faculties. Other than health sciences, which give education about health and communication, trainings and seminars need to be given to media professionals. Yes, Nur, I mean, there are some comments I'm seeing. Everyone can benefit from health literacy, regardless of age, regardless of gender, ethnicity, and income. And the last slide, the contribution of high literacy level induces positive health outcomes. The life quality of people will be better, and the people will improve their health, will promote their health, and also prevent diseases. Efficient healthcare activities will be better. I mean, the doctors will have more time for really sick people, as I mean, sometimes illiterate people go very frequently visit doctors and pharmacies, and this will also naturally cause a decline in healthcare expenses. Okay, this is from my side. I mean, what I can share with you regarding health literacy. I am ready to answer your questions, if any, and I thank you very much for listening.
We thank you so much, Professor, for accepting our invitation to this event. Also, we have some questions that the students asked us in the form they filled. One question is from Osama Marbani. He says, can we use health literacy in other departments than pharmacy? I think we answered these questions through the slides. If you want to contribute more, Professor.
Okay, actually, I mean, health literacy implies to all departments, to everybody, to each individual, and I mean, it is a multidisciplinary approach, and everybody needs to be health literate for himself and also for the public.
Okay. Also, there is a question: what skills should we master for health literacy?
Okay, critical thinking is very, very important. Good communication skills is very, very important. You need to be analytical, and of course, I mean, you need, what was the definition of the health literacy? I mean, you just acquire the information, After acquiring the information, you have to understand. After understanding, you have to evaluate. After evaluating it, you have to communicate. And after communicate, you have to use, of course, at first, and then also communicate. Okay.
Also, how can we improve low health literacy?
As an individual, of course, I mean, what you can do is, I mean, for example, you have, if you are, let's say, a low illiterate person, you just listen to some lectures. I mean, you can read, you can try to understand what health literacy is about. And I mean, for example, it depends on you. I mean, who you are actually. Who are you?
Exactly. Also from the chat box, guys, you can right now on the chat box or open your microphones in order to ask
Yes.
Professor Inji Kayan any questions. There is a question from Noor Al-Azzi. Sorry, it's not a question, it's just a contribution that says social media can be used to raise awareness of health literacy. Also, another question from Iman Abdullah. Is critical health literacy related to pharmacovigilance?
Yes, yes, of course. I mean, you have to be health literate about pharmacovigilance. This is very, very important. Mm-hmm. Because you have to know I mean, you have to at first to read the prescription, the information leaflet of your medication, and you have to understand it. Most of the time, actually, I mean, these information leaflets were full of jargon and very difficult to understand, but the healthcare industry the pharmaceutical industry has worked on that and tried to, simplify this. Because I mean, it is very, very important that I mean, you as an individual, it is very difficult, of course, to understand the jargon, which is in some of the information leaflets, and also in the prescription. Sorry, not prescription, but packaging.
Yes.
Okay.
Are there any more questions, guys? You can open your microphones too. Okay, I think that's all. Dilara, are you there? If the students would accept that, they can open their cameras in order to take a screenshot all together, since it's the last day in the event. Professor, also with you. I'll just stop